All right, okay, and we are live. Hi, good evening, everyone. All right, okay, good. Let's watch an intro video first. Okay, hi, and we're back. All right, good. Hi, good evening, everyone. Good evening, everyone. All right, okay. Today we're just having a casual chit chat session to answer all your any of your dental questions or any of the dental concern. Feel free to leave your questions or comments below. All right. Okay. Good. So just put in any questions if you have. All right. Hi everyone. If you're new here, okay, my name is Dr. Tristan Pei, Singapore dentist with 16 years of clinical experience. I have keen interest in wisdom tooth surgery and in sharing my dental knowledge online. Over the past few days, I have received numerous inquiries and appointments for wisdom tooth surgery. Thank you everyone for wisdom tooth surgery appointment. You can always click the link below. I have included a link below. Okay, and thanks everyone. Okay, for the overwhelming response. All right. Yeah. All right. Good. Okay. Wisdom tooth surgery is something close to my heart, and it's something that I'm sort of like a procedure that I do a little bit more. All right. Oh, good. Hi, yeah, good evening, everyone. Okay, if you are here watching live, all right, or watching on the replay, okay, thank you very much for being here. Okay, live, replay, both are great. All right, let me know where you're watching from. Okay, I'm actually in Singapore now, of course, and let me know where you're watching from. Maybe you can let us know your name and just know where you're watching this from, which country are you from. Okay, and that'll be great. All right, we try to keep this Facebook Live session as interactive as possible. In order to be interactive, I will need you to participate. Okay. Yes, if you can type something. All right. Type hi. Okay. Type something. Then that'll be great. All right. Then we can have some interaction. That will be perfect. All right. Also do like and share. Okay, this video so that more people can benefit from this video. You can share it to your profile. Okay, and also to 3 other Facebook groups. Okay, I thank you on behalf of the people who benefited from your sharing. Also, do give me lots of love, and wow, and that will motivate me to give you all lots of value. All right. Okay. Good. Let's have a look at. All right. Let's have a look over. Okay. Good. All right. Okay. We have Sopo Tang. Oh, my mom is here. Okay, Chris. Hi, Chris. All right. Good. Chris is Dr. Chris Mark is actually my classmate. All right. Good. All right. Nice of you being here. Okay. Yo. Hi, Chris. All right. Good. It's Dr. Chris Mark is one of my dental classmate. We actually graduated in 2004. Okay. And I still remember vaguely that in 2003 or 2004, we actually went together to watch our first Jay Chou concert. All right, I think Jay Chou was just coming out around that time. So that was then. Good. All right. Yes, Chris. Okay. Good. All right. Okay. So hi everyone. Okay, if you have any questions, do feel free to put in the comments below. Okay, and I would love to answer all your questions. Okay. Good. On the side also, I'm actually working on an online course now. Okay, I'm working on an online course, more of a structure, because I realized after doing Facebook Live, after communicating with the community, everyone is asking me for something more structure, because information seems to be a little bit more tough for everyone to receive. In fact, I've been doing my best. So you can see that even in this live video, I've actually included a list of past videos that are useful. Okay, so do check it out after this video. All the different dental subjects like teeth whitening, wisdom tooth, how to brush, how to floss better, how to prevent with tooth decay, water flosser. Okay, best maybe toothpaste for kids or whitening toothpaste and etc. etc. And also, if you have fear of going to a dentist, I also included a video inside. So in this video, you can look at the description below. There's actually a lot of information that you might be keen to. But don't look at that. Don't look at that yet. Okay, watch this video. All right. The best thing is actually not watching the video, but the interaction that we can have together over here. All right. I think this is actually quite invaluable. Yeah lah, bro. Okay, flashback. Yeah, I remember you actually invited me to Jay Chow concert. I mean, I was that was so long ago. But amazing. I also get to spend I think some nights together with you and Ashraf. We actually went over to Malaysia. Okay, to visit Chris. That was I think after our graduation from dental school. Fond memories. Okay, we have one of the best time together. All right. Yeah, just after dental school, everyone become too busy and either working, developing our dental career, forming our family, raising kids. We should find time to catch up. All right. Good. All right. We're just doing some chit chat first, then I'll answer some questions. No worry. Good. Keep your questions coming. Okay. I will make sure I answer according to order lah. All right. Good. All right. It's I'm good. All right. And let's see. Yeah. Okay. So who is here? Kelvin is here also. Hi. Pauline. All right. Pauline also came by. Hi, Pauline. All right. Good. Ken, Ziyong is here. Pauline. All right. Hi. Yes. All right. Okay. So what we're gonna do now? All right. Okay. Let's look at some of the questions here. All right. Good. Yeah. Do let me know in the comment section if there's any questions you want, you would like to know. I would love to share more information with you all. All right. Okay. We keep it as candid as we can. Good. All right. Let's see now. Okay. Diana Moses. Okay. Hi, my tooth. Oh, ACH is too much. Okay. What is ACH? Let me try to figure out. Hi, my tooth. ACH. Try not to have a short form. Because we have an international audience. Okay. And for myself also, some of the short forms I might not be aware. So, hi, my tooth. Of course, aching lah. Sorry, So actually, it's quite straightforward. Okay, hi. My tooth ache too much in this cold season. What could be the problem? All right. If your tooth is aching too much, okay, having discomfort, especially cold season. So I guess it's maybe when you're taking any hot, cold, especially cold food and drinks. All right. So if the teeth is sensitive to cold food and drinks, all right. Some of the common reasons could be number one, okay, it could be due to excessive brushing. Sometimes when we brush our teeth too hard and too heavily, that can actually cause the tooth surface loss. So our teeth has actually 3 layers. Enamel, the first layer, second layer is the dentine, third is the nerve. Also, when we brush too hard, we do have cases where the enamel wear off, exposing a dentine, or sometimes when we brush too hard, the gums actually recede and we have actually exposed root surface. Root surface are actually more dentine in nature, so they tend to be more sensitive. So if it's sensitive, brushing too hard could be one of the reasons there. Of course, sensitivity could also be due to a possible defective filling. If a filling is not sound, when it's leaking, when you take anything hot and cold, that could also be the reason for sensitivity. In short, there are many reasons why sensitivity can occur. Okay, so at home, what can you do? All right, at home, what we can do is always have good habits. Good habits like brushing twice a day, each time 2 minutes, making sure we reach all the surfaces, having a good system. I've actually included a video on bus technique. That's the brushing technique which we learn in school, which is one of the best technique. We all dentists would love that all our patients learn the buzz technique. Unfortunately, in the clinical setting, in our dental chair, we have so little amount of time, and sometimes it's not possible for us to share this buzz technique because sometimes it can be quite complicated. But check out the link below on the video on buzz technique. I think it's by this Dr. Chatter. I think its video is quite informative. All right, so you can look at the buzz technique. I think it's quite good. So brushing well is one thing. Flossing well, okay, good to floss once every night. By flossing well, you remove all those food tract bacteria. Also, we reduce the chance of gum inflammation or gingivitis or any gum issues. So if you can reduce gum issue, then less likely the gums will shrink, then we also have less sensitivity. What else can you do? Okay, at home, if you do experience sensitivity, you can get hold of this Colgate, either Colgate Sensitive or Sensodyne toothpaste. All right, Colgate Sensitive or Sensodyne toothpaste, either of the sensitive toothpaste. Also, what happens that you can use the sensitive toothpaste, apply a little bit of toothpaste on the finger. All right, just a little bit will do. Rub on the surface that's sensitive. Leave it there for maybe like 5 to 10 minutes. All right, or while you watch your TV. Nowadays, not many people watch TV. You can surf your internet, look at Facebook, play your online games, do etc. that you want. All right, and once you are done 10 minutes, then you can take a toothbrush and brush all the area. You can do this every night, okay, until sensitivity comes down or goes away fully. That'll be great. So these are all some of the things that you can do while you are at home. Okay, these are some of the things you can do to manage aching or sensitivity. Okay, now we're talking about sensitivity. Aching at home. Also, you can use a mouthwash. However, there are some situations that home care treatment or home care. There are certain things that there's a limit to what we can do at home. So if the discomfort or sensation still persists, we would strongly suggest that you actually go down to your local dentist, okay, or your dental clinic to seek dental advice. Okay, they could have a look. They can run through more tests like X-rays. They have cold tests, hot tests. Some of the more elaborate equipments in the dental clinic to help to understand what's the cause. Okay, and once they can understand the cause, they can actually give you a more proper treatment options. Then you can decide along the way. All right. So I guess that's one way you can. I guess that's what you can do for 18.2, because 18.2 is actually quite big. Not that I don't want to streamline to a particular solution. It's just that if your question is wide, I'll just answer as much as I can. All right. I hope I answered your question, Diana. All right. Good. Okay. If you all like what you're hearing so far, okay, and join the sharing sessions, give me a thumbs up. Give me type something, wow, anything. That will let me know that actually I'm interacting with real people online. Because it's quite a unique experience actually talking to a screen, okay, and I'm just trying to visualize that everyone in front of me are keen. Of course, are keen and asking questions. All right, okay, good. Let me just swing over to the, because I'm looking at StreamYard, the software I'm using to watch all this. I'll just go over to see whether there's anything. Okay, seems like there's more questions. Okay, good. Good. All right, so then I hope you answer the questions. If you find the answer okay, please give me a like or comment something. All right, thank you. Okay, let's just go. Good. And all right. Hi, Joseph. Hi. Nice of you coming back here again. Good. Yes, Chris. All right. Good to have you here tonight. Thanks for being here, Chris. Dr. Chris Mark. All right. Thanks for being here, and Dr. Pauline also. Dr. Pauline is also my classmate. Okay. I have two classmates that actually got married together. All right. Isn't it wonderful? All right. Good. And yes. Okay. And let's see here. Okay, Victoria. Okay, Victoria mentioned that there is a recurring pain that usually comes up at the gum behind my molar. Okay, I'm using my hand to guide where the possible discomfort is. So recurring pain, sometimes it comes back. Usually comes at the back of the gum behind my molar. At times it got swollen. So what can I do to stop it? Okay. So first of all, okay, if you are at home, if you have recurring pain at the molar, what are the things you can do at home? Okay, brushing well, flossing well. These are the two things you can do. On top of that, if you can get a hold of a mouthwash solution, okay, with a toothbrush, you can actually dip your toothbrush inside a mouthwash solution. Okay, after that, you can use it to scrub the inside. That will actually allow the mouthwash solution to go into the sometimes the infected tissue, and that can actually help to decrease the inflammation of the area. So it's a good idea to do that. So home care, what else can you do? Brushing well, same thing. Brushing well 2 times a day. Okay, keeping the area clean, flossing. Okay, usually gum infection means that certain areas or gums are having pain. Some areas we're not able to clean well. So the best thing you can do is cleaning it well. All right. Of course, if the discomfort persists, what else can you do? You can actually take painkiller. All right. But do good to check with your dentist or your medical doctor if you have any allergy to any medication before you take any of them. Example of painkiller are like paracetamol, Profen, methyl acid. These are all possible painkiller that you can take. So if in pain, good to look at pain relief. And if the pain persists even after you do all those things, always, even if the pain actually goes over, I would still strongly advise to actually go down to a dental clinic, let your dentist and dental clinic have a look at the area. If it's no issue, great, congratulations. That's good. At least you have a peace of mind. However, sometimes a small issue is a signal that something is not right. When you can address the issue early, sometimes it can be as simple as just a cleanup, all right, or just a simple filling. However, if we miss out this initial, these are like alarms. The discomfort that we have is actually like alarms. So these alarms will actually sound off and get us more alert. We go down to dental clinic, we do something early. If we don't seek this alarm, sometimes if you don't take note of this alarm, sometimes bigger issue can occur. Then we might need to look at things like root canal treatment, crowns, or sometimes even removal of the tooth. We will love that will not happen to you. Okay, I'm sure this will not happen to any of you as long as we practice good oral hygiene. Okay, everyone here in our community, okay, we will practice good oral hygiene, okay, and make sure that we will have less dental issue. All right, that's what we're here for. All right, there's no point learning after that not using. Then it's also it's good. It's good to keep practicing. If you find too many, the informations are too much, then do that in bit size, or maybe focus on one habit at a time. Then slowly move from there. All right. Good. So at the dental setting, I hope I answered your question, Victoria. All right. Good. Give me a thumbs up if you find that. Good. All right. Okay. Let's see over here now. Okay. Good. I can move forward a bit faster now. Okay. I think I missed out a few people here. Sorry. I just. Okay. Hi, Mary Sil. Oh, nice of you being here. All right. Okay, good evening or good morning. Okay, it depends on where you're watching this from. All right. And hi, Abigail. Okay, hi, Abigail. Good. And Naza from Pakistan. Nice of you being here. We have friends from over the world, and majority of my friends are in Singapore, but I'm glad to have a lot of friends from over the world. Okay, good. Thank you very much for being here. But of course, if you have any dental questions, do let me know. Okay, so Abigail, come on with the next question. Okay, I always have swollen gum since my pregnancy, and it comes and go, and it really destroys my teeth. What can be done? Okay, during pregnancy, because of hormonal changes, our gums tend to bleed a little bit more. Preventive-wise, what we can do, of course, is having good oral hygiene, brushing well, flossing well. But on top of that, always, if you find that the gums are still not ideal, it will be good to have a cleanup also. The cleaning will help to remove all those stubborn stones, tartars or deposits that's in between the teeth. When the deposits are formed and to a certain thickness, even if you brush well, floss well, you also can't remove the deposit. The deposit acts as a rough surface and will attract more bacterial plaque forming and will cause more gum redness. So if you're frustrated saying, how come regardless of how good you clean and the gums are still bleeding, it's time to head down to the dental clinic, let your dentist have a look, have a good clean, or remove all the deposits. Once the deposits are removed, usually you'll see redness in the gum, okay? But once the deposits are removed, the gums can start breathing again. All right, when the gums can start breathing again, it will still bleed every time you clean, but what happens is that every time you clean, you'll get better. So after a good 2-3 days, okay, or 1 week, you can see the improvement. The key thing to look out for is improvement. If the gums are very red, don't aim for a miracle that after we clean, no more bleeding. It doesn't happen that way. All right, if it bleeds when we clean, yes, it will be bleeding, but it will keep getting better. Just be very patient and keep doing what your dentist or dental clinic suggests. I have actually put on a video on. Okay, the video on brushing and flossing, I think I mentioned a few times now. You can check in the link later on the technique. Okay, so so this is what you can do. Prevention is the key way. Yeah, oh, good. And it's really destroying my tooth. What can be done? We will love that, no issues. However, if you are really in severe dental pain, the next option, what we're looking at here, is actually to remove. Is to do root canal treatment, or sometimes to the extent of removing the tooth. Do pop by to your clinic to let the local dentist have a look. I think that'll be a good idea. All right. Okay, let's see now. And hi. Good to have you back here again, Ice. All right, good evening. All right. Good. Okay, thank you, Ice. Good. Okay, good. All right. Chinchanem. Okay, Chinchanem. Okay, mention this question now. Okay, thanks for the question. I have bleeding gums when brushing and am using a soft brush. Okay, so if the gums are bleeding, okay, when you're brushing and using a soft brush, that also means that the gums are infected. Okay, so using a soft brush is a good thing. Okay, but if the gums are really not in a healthy stage, of course, when you clean, it will bleed. So you see, bleeding gums, okay, this is what we mean by healthy gums. Over time, healthy gums won't bleed. But when you reach a threshold where it start bleeding, that's where we start noticing that it's bleeding. Also, when we start cleaning it well, what will happen? It will still bleed. If you brush well, floss well, what will happen? Because we really hit this threshold, the gums are red. No matter what you do, you brush well, you floss well, what will bleed? But when it bleeds, it means that you are cleaning it well. Okay. If you look at the whole tooth, if you look at this as a whole tooth, if the gums are red, if I only brush the top part of the tooth, the gums will never bleed. Then we have the illusion that we're doing well. But when you clean thorough, you clean the whole tooth, okay, and the gums will bleed, that's a sign that you're doing well. When you're doing well, what you need to do is to keep doing well. Brushing it well, flossing it well, okay, and when you do it well, it will bleed. When you keep doing well, it will get better. That's one of the things you can do when you're at home, okay, to clean your teeth. Yes, this is one very, very important question. Because as we're doing cleaning for all patients, no one likes to see bleeding gums. When you're at home alone, when you look at bleeding gums, what most people do is that when they see bleeding gums, they'll be shocked. The gum is bleeding. And you know what's the next thing that most people do when they're shocked? They avoid touching the gum. Now, if you avoid touching the gum, what will happen? It will not bleed. And that will make us feel pretty good. Okay, and when you feel pretty good, you start encouraging yourself not to touch it. And when you don't touch it, the gums become more inflamed, more bacteria coming into the area, then we have more issues. So it's definitely a good idea, okay, to at home focus on brushing and flossing. If it's bleeding, keep doing it, it will get better. All right. If it's not getting better, then you will need to see a local dentist or dental clinic for better dental care. All right. I hope this answers your questions. Okay. Good. I also included links on some of the things you can work on bleeding gums. You can check out the links below. All right. Good. Thank you. Okay. I have very sensitive teeth. Nazar was saying, I have very sensitive teeth. Even I brush twice, taking too much care. Okay. So when you brush sensitive teeth, okay, when you brush twice, taking too much care. Also, always brush with a soft brush, soft bristles. The harder or medium brushes, bristles can actually cause wear to the teeth, and that can actually cause teeth sensitivity. So always go with a soft brush. If the teeth sensitivity is really sensitive, go with either choline sensitive toothpaste. That will help to reduce teeth sensitivity. All right. And if it's still not getting well enough, you can either go to a dental clinic. They will assess the condition. You will if they can either put in a filling desensitize the area, or they can put in some treatment to desensitize the area, fluoride therapy. They can do a crown root canal treatment. These are some of the possible options that we are looking at here. Let your dentist have a look, then they can advise you more. All right. So don't brush too hard. Go easy with your tooth. And I hope I answered your question. Good. All right. Okay. Good. Okay. Doreen. All right. Okay. One of my molar tooth has a cavity and it's painful. Apart from extracting, is there any medicine that I can use to stop pain relief completely? Completely. All right. Okay. Let's see. Do we have a miracle medication? At this point in time, pain relief. Okay. In the dental clinic, basically we have. With research, with clinical trial, with evidence-based. What we're looking at here, we have basically in the dental clinic, paracetamol. All right, and also mefenamic acid, also known as Ponstan. Paracetamol is a molar form. Ponstan or naproxen, okay, it's something a little bit more stronger. Also, you can actually look at the getting either two, but do check with your dentist or your medical doctor if you have any drug allergy before you take any medication. All right, it's for your own safety. All right, good. So this is what you can do to actually reduce the pain. Okay, and if the molar has a cavity, of course, please go and get a filling done. Early stage will be a filling. Later stage, what we're looking at here, we are looking at possible root canal treatment or crown. All right, and please don't delay. Okay, always seek treatment earlier. Okay, and I wish you a good recovery. All right, good, and yes, also painting. Yeah, good. So it'll be good if you have if you would like to look at other options instead of extraction. Always communicate with your dentist. The dentist can share with you different treatment options. What are the possible likelihoods of either keeping? What is the chances of success rate? Or what is the if you were to keep, what's the success rate? If you remove, what is the replacement option? Replacement options will include things like dental implant or dental bridge, or sometimes even the denture. So these are the possible options there. All right. Good. I drink some water. All right, I drink some water there. All right. Okay. So if everyone, okay, if you all like what you're seeing, if you all feel that you'll gain some value from this session, do give me some likes, heart, love, share this video to more people. And I'll thank you on behalf of all the people who benefited from this sharing. All right. Good. Okay. Let's see now. Okay. Good. Okay. Pavin. Okay, mentioned. Hello. I always bleed blood when I brush. Please help. Okay. When you brush and there is bleeding. Okay. You see, dental issues are sometimes quite similar. All right. You realize that actually a lot of people have similar questions, but it's also very unique to everyone. That's the irony, because bleeding gum sometimes can be due to many factors. But you see me repeating the same or similar things actually over and over again. So if there is actually bleeding gums, okay, what you can do, it means that the gums are inflamed. When we have inflamed gums, there's actually two types of gum inflammation or two types of gum disease. The milder form is called gingivitis, where the gums are inflamed. Okay, the severe form will be when gingivitis prolonged or the swelling of the gum prolonged for a long period of time, and that will actually lead to bone loss. When bone loss, gum recede, then this is called periodontitis. All right, so we would like to avoid gingivitis or the early stage of gum disease and the late stage of gum disease like periodontitis. By avoiding these two things, we can maintain the bone level and the gum level. Then we can avoid things like removing of the tooth. All right. So yes, if the gums are bleeding, okay, when you brush, that means that, okay, remember what we mentioned. Okay, if the gums are bleeding, it means that the gums are not ideal. So if you brush it, it bleeds. Keep brushing. Okay, keep brushing, keep flossing, and use a mouthwash. Okay, these are the things you can do. Okay, and if you clean it well, it will bleed. That's how the gums will get better. But if you're so fearful that you are not willing to let it bleed, I can understand. You are not alone. Okay, there are many people out there having this issue. I've been practicing dentistry for 16 years. This is a problem for everyone. Okay, no one like to look at bleeding gums. When the gums bleed, some people are comfortable looking at it. Some people just don't want to look at it. Why? We're all made differently. Yes, if it's bleeding, keep brushing well, keep flossing well, get in the habit of doing it. And what you will do is that when you keep cleaning it well, it will get better. Then over time, the bleeding gums will go down. If it goes down, great. Okay, if not, go and see your local dentist, okay, or dental clinic for solutions. All right, they usually do a cleanup, okay, and they can do a cleanup, they can do gum treatment, they can do a few other things. All right, good. Okay, I hope I answer your question. Adesu, okay, my gums bleed when by brushing. Okay, so what can you do about it now? Bleeding, brush still, brush twice a day. Okay, bleeding means that the gums are not ideal. It's similar. All right, so you can look at some of the things I answered just now. So brush twice a day. Okay, and keep cleaning it. The gums will get better. All right, don't let the bleeding gum stop you from cleaning the teeth. The last thing you do is to avoid. All right, good. Okay, very good. Mark has a question here. How do I get rid of yellow teeth or yellow stains with low budget? Okay, let's see. Okay, first of all, it's two questions. The first thing is how to get rid of yellow stain or stains on the teeth. Okay, to get rid of stains on the teeth, use a soft brush. Make sure you clean your teeth well. Okay, and of course, if you can avoid food that contain lots of stains, like things like red wine, curry, coffee, tea. Actually, in fact, a lot of food that has coloring, if you can avoid or take less of them, then you have less likely to have stains on the teeth. That's one thing you can do. Okay, and what else are we looking at? Curry also. This is some things that can cause more stain. Okay, and so reducing the item that actually can cause staining, that's one thing. Good oral hygiene, like brushing and flossing, these are also very important. Okay, low budget. Okay, very good question. Low budget. Okay, this is also one of the common questions everyone look at also. For low, if the budget is low, okay, in the community, okay, in your local community, I'm sure there'll be some community care that is given around. You can look for that. Okay, and they might provide a free dental service or maybe dental service at a minimal cost, or that's somewhere you can go to. Of course, alternatively, okay, this is the next best. All right, okay, please go and visit your local dental university school. Okay, how do I put this on? Okay, go and visit the dental students. Okay, in most country, okay, there will be a dental school where dental students will be residing, learning the art of dentistry. Usually, in Singapore, in Singapore, we have 4 years of our in our undergrad course. Okay, so 2 years is actually pre-clinical, where we study all the similar subjects and some dental subjects with the medical people, medical colleagues. Okay, and the last 2 years, we actually will have clinical practice where we see real patients. Okay, so you can actually go and find a dental school, okay, where they need dental patients. Okay, dental students are one of the best dentists. Okay, they are very careful. Okay, and they're very careful. And you also have more than one person looking after you. Usually, we have another dentist, or sometimes, and the assistant is a dental student also. So basically, you have the 2 dental students and also a dentist looking after you. All right, so you'll be in good hands. And fee-wise, usually, because it's training, fee-wise usually will be much lower. I hope that answer your question. Good. All right, good. And okay, all right. Sonam is saying, hi doctor, good evening. Yes, is it good to remove my teeth lah? Okay, as much as possible. Okay, when I look at this question, no pain, no issue. Keep all your teeth good and well. Maintain, don't remove. If the tooth is not ideal, then yes, you might want to look at remove. As much as you can, try to save. I'm more into conservative. I'm very conservative. If there is a decay put in a filling. If the decay is bigger, then we might still want to put in a filling, but be prepared that might need to a root canal treatment. If need to, sometimes we do root canal treatment and crown. But if worst case, we can't say, then we will look at removal. So discuss with your dentist. I think that they can share a few more. All right. So now I hope I answered your question. Good. Thank you. Okay. Rolf here. Hi doc. We brush when we bleed. Okay. I think this is a common question that we have. I'm sure I explained just now already. So you can have a look at the previous explanations. Okay. Good. Yes. You see, this is Pauline and Chris. All right. This Dr. Pauline and Dr. Chris. They are both my classmates. We graduated from 2004. That's so long ago. All right. So long and so not so long also. Anyway, thanks for your support. Thanks for your support, Pauline. Oh, okay. Struggling and yeah, struggling, but trying to struggle well. All right, good. Okay, so Mubashira, okay, saying how to get rid of teeth sensitivity. I have included links on some of the things you can do to reduce teeth sensitivity. You can also check out the video below. Okay, to reduce teeth sensitivity, use Colgate Sensitivity Sensodyne toothpaste, which is what I mentioned also in the early part of the video. Do have a look at that. All right, good. Good. Bear with us, everyone. I would love to answer everyone's question again and again, but due to the benefit, you can actually always go back to the replay. I've actually answered quite a lot of questions. All right, by watching the replays, you can actually gain some valuable knowledge from our sharing. All right, good. Eric, okay. Eric is here. Hi, Eric. Okay, Eric is a good friend, a dear friend from my army times. Okay, in so long ago, okay, in the artillery force. I can say that, right? It's not secret now, I guess. So we're good friends. Yeah, good. Good to have you here, Eric. So yes, sir. Need help? My teeth is grinding issue. Anything I can do to stop it? Okay. If there is grinding, all right. Grinding usually means that the teeth is wearing down. Let me see whether I can show what does grinding. Because this picture, I think, will explain a little bit more. So just give me a second while I load up the image here, okay, on grinding, okay. I think this image will be good. Yeah, if there's actually grinding issue, where's my grinding slides? Let me see whether I can show. Okay, just give me a second. Grind. Okay. Yeah, good. I think this slides will be good. All right. And I just share screen. Okay. Good. Okay. All right. So if you're looking at the grinding, all right, you can look at the picture over here. When this is our position of our tooth. But over time, if there is actually grinding of our teeth at night, usually your family members or your or your partner will realize the sound. Okay, loud sound when you're sleeping, or second thing when you wake up in the morning, you feel tiredness in the jaw. These are some of the common signs that we are looking at active grinding. So you look at this picture here. When the healthy tooth, okay, when we healthy tooth, everything is very well aligned. When there's active grinding, we can see there's actually tooth surface loss. When we have active loss of our teeth surface, imagine our teeth has 3 layers: enamel first layer, dentin second layer. Sometimes it can also lead to teeth sensitivity. So if we have active grinding, Eric, if you have active grinding, okay, do see your dentist. Okay, you can come and see me. All right, I'll make sure I look after you. All right, and to have a mouth guard done. A mouth guard is a plastic shield. Okay, and this mouth guard will be you can wear it for the top jaw. So sequence-wise, what happens is that when you come to the dental clinic, your dentist will actually take more of the top jaw, and after 1 week, this mold they will send to the lab. The laboratory will actually come back to make a mouth guard. This is the one that you're looking at over here. So after the mouth guard is done, okay, usually 1 week later, okay, then we'll be doing the issue. And how to wear the mouth guard every night? You brush your teeth, floss, do all your necessary care, then after you can wear it to sleep. If you have trouble using a mouth guard initially, then what you can do is try wearing it in the daytime, maybe for a few hours to get used to it. After that, along the way you can actually use it, do it at night. Sometimes some patients have trouble sleeping with a mouth guard. So it takes some time. Be patient with it. All right. Okay, so mouth guard is one thing. Of course, reason why teeth grinding, stress, all these things are some reasons. I also included a video link on teeth grinding, one of the Facebook Live video that we have done previously. Eric, do have a look at that. I think that will help you. For anyone who are keen to find more about grinding, can look at that. The time now is 9:44. I try to speed up a bit. I also don't want to take up too much time. Normally, our session is about half an hour. We are a bit overrun. Bear with me. Okay, and let's see. A bit overrun. I think we can do another maybe 5 more minutes or so. All right. Okay. Hi, doctor. Sometimes my gums bleed beside my premolar. I have a hole. If you have a hole, good to get a filling done when it's early. Okay. Don't let it become a bigger issue. Okay. That will be something. That'll be something good to look at. All right. Good. All right. Okay, everyone. If you just came in here, okay, thanks for being here. My name is Dr. Tristan Pei, a Singapore dentist with 16 years of clinical experience. I have keen interest in wisdom tooth surgery. I would like to thank the community and everyone in Singapore or from overseas. And over the past few days, I've received numerous inquiries and appointments booking for wisdom tooth surgery. I am shocked. I don't know whether it sounds silly, but I do enjoy doing wisdom tooth surgery, and it's a procedure I'm very comfortable. I have keen interest, and I do enjoy. All right. I also included a link below where you can make an appointment with me. You can make appointments with your local dentist. I'm situated in Singapore, so might not be accessible to so many people in the world. But any questions, I'm here. All right. But if there's any, if you are living very far from Singapore, yes, good to see your local dentist for treatment. All right. Okay. Good. Yes, if you like what you see, please give me some likes, a heart, share. That will motivate me and encourage me to share more. All right, I think I go back a little bit on this. Don't see anything here. All right, Patrick is here. Hi, Patrick. Hi, Vincent. Hi. Like I can see the like. Yeah. When I look at the Facebook, I think I can see likes coming out. It's quite interesting. I think I focus on looking at comments. But keep the likes coming, the love and wow. Yeah, that actually will make the whole live experience more fun. When I go and visit some live video, when someone go and support my friends, I always spam the like button, or sometimes I spam the love button. And I can see the expression, they'll come up and quite shocked. All right, okay, let's just go to our questions. Okay, we answered that. Okay. Hi, Jacqueline. All right, good. Thanks for being here. Okay, good to have you back here again. All right, good. Yes, Eric, of course. Good. Good. I haven't catch up for a long time. All right, good. Stay well, stay good, okay, bro? All right, good. And okay, Nimra say, can we remove gap between teeth? Okay, and that's a good question. If we have gaps in between the teeth, can we remove gaps? Okay, if we have spaces in between the teeth, the best way to remove gaps is braces. That's the most conservative way. When you move your teeth closer together, you cover up the spaces. Most conservative, and I would say this is still the best method. If you find that you would still prefer not to do braces, other possible options, I say possible options could be either fillings, or you can look at crowns or veneers. Yeah, these are what we're looking at here. Closing gaps, remove gaps between teeth. Okay, can we remove gap between teeth? Means we have gap. So if we have gap, we can either do crowns. Okay, then we can close out gap. Do braces to move the teeth together. Okay, we can do basically crowns, bridges. All these are the possible things you can do to close up gaps. I hope they answer your questions. Okay. Usually, why people want to close up gaps is because food trapping. Okay. That's actually the reason why people ask this question. How can I make sure no food trap? Is it possible to cover up all the space so the food won't get trapped? If any dentists are here, I'm sure you also understand this thing that we're talking about. People want to cover up the space so there's no food trap. But in truth, we can't actually cover up in between the teeth because our teeth are individual. So if we put fillings in between and our teeth are moving in a different direction, the filling will not hold. And filling will not hold because teeth are actually moving slightly different. So with time, if you put a filling that's linked together, over time they will still dislodge. And then you start trapping food. And a filling that is placed just to cover up the spaces will end up trapping more bacterial plot, can cause more gum redness and more issues in the future. That's why we don't just cover filling this way. If you want to have a proper way, it's still braces to get the teeth aligned so that you can still clean the area well. Yes, a filling at times it can be done, all right, or crown or veneers, all right. Okay, I hope I answered your question. Thanks, Eric. Thanks for being here. Okay, good. No, not bye-bye yet. Not bye-bye yet. Good. Ivan. All right. Okay, good. Hi, Ivan. All right, good. Ivan. You were posting some cakes, right? You're making some cakes online recently, right? Thanks for the cake. We'll look at very interesting ideas you have there, Ivan. All right. Good. And okay. So the question is, how can I get professional tooth cream? Wow. 3M Clean Pro tooth cream. Okay. I guess there are so many products, so many teeth whitening products out there. All right. If you Google 3M Clean Pro tooth, I'm sure you can find out some information on that. In the dental clinic setting, okay, there are basically in the dental clinic setting, okay, in the setting that we're looking at here, there's actually 3 common ways to have whiter teeth. Okay, number 1, all right, is over-the-counter products. Over-the-counter products like white strips. Okay, we have toothpaste, all these things. But when it comes to product, the most important thing you look at any product that is out in the market, look out for ingredients. Okay, the first ingredient is hydrogen peroxide. Okay, hydrogen peroxide. The second ingredient is carbon peroxide. Okay, these 2 ingredients are important for teeth whitening. Some toothpaste will actually claim that they actually whiten teeth, but in fact they don't contain these 2. But what they claim is also nothing wrong. When our toothpaste have normal abrasive, so when we use it to clean up all the stains, it actually whitens your teeth. So there's nothing wrong with that. But if you really want something to really whiten the teeth, to break down the bonds, the complex carbon bonds is inside the tooth, then you need these 2. Peroxide, hydrogen peroxide, and carbamide. I also done up a detailed video on how teeth whitening work. It's actually in the video in the link below on how teeth whitening work, and also some of the few tips on teeth whitening. You can look at the video link below. That will share you more information. All right, and yes, okay. So okay, going back. So knowing how it works, then you know how to evaluate or know how to choose the product. Then the first one what we're looking at here is okay, over-the-counter products. Okay, you can get if you Google, you can find so many products. Okay, yeah. So I also come up with some products that I also come up. Also been looking and doing some research on some of the product. Also keep putting some link there on toothbrush. You can have a look if you want to. All right. So number 2, what else are we looking at here? We have on the dental chair setting, we have the chairside teeth whitening. Okay. Chairside teeth whitening usually it takes a good 1 hour to whiten your teeth. All right. And the dentist can do it well for you. All right. The third thing, of course, what we're looking at is home care whitening. Basically, you take a more of the top lower jaw. All right. And 1 week later, you have the whitening tray. Once you have the tray, every night before you sleep, you apply gel. You wear it until the next day morning. Okay. Or it can be for a few hours. It depends on the your dentist or dental clinic advice, or sometimes it can be just a few hours. All right, and you can do it for every night for 2 weeks. If there's sensitivity, you can always do alternate week. Okay, my favorite is still home care whitening. All right, why I find home care whitening is better? Why my preference home care whitening? Once you have a tray, okay, customized home care whitening, you have a tray that fits only to your teeth. Maintain everything well. The tray whitening doesn't last forever. It can last you 2-3 years. But once you have a tray, you can use the tray again. Also, 2-3 years down the road, you just get gel. Also, it's very effective. Okay, and you can do it at the comfort of a home. All right, and how white is white is really depend on individual. So once you have a tray, you can gauge along the way how white you want, and but of course there's always a limit to how white the teeth can whiten. Also, don't overuse any teeth whitening product. And usually teeth whitening that will have teeth sensitivity and gum soreness. These are all temporary. But if you overuse products, sometimes it can give you more issues. But in doubt, always go back and see your dentist for advice. All right. Okay, good. I hope I answered your question, Ivan. Thank you. All right, and Eric, yes, okay, good. Ask here and find for you. All right, Google. Google. I refer you to see Google. Google has a lot of information there. All right. Okay. Yeah, last time, yes, in the military, I was the QM. I was the Army Quartermaster. I'm helping in charge of store. Together with my fellow colleagues, Ari and a few of my fellow colleagues. Good, good, good. Good. And yes, this is Ivan. All right. Okay, we answered that. Okay, let's go. Let's go. Okay. So if I lost my brush and unable to purchase it or bring it, so if I lost my toothbrush and unable to purchase it, or well, if you lost your toothbrush, can you use other ways to brush your teeth? I would still advise find a toothbrush. Okay, or find a toothbrush. Yeah, you just need a toothbrush to clean. Using hand, using other methods just sometimes doesn't clean it so well. So to find the best way to brush your teeth, look at the bus technique video that I included. This video is not done by me, but you can look at it. I think they actually show quite a useful way to actually brush. So do get a toothbrush. Okay, don't compromise. Okay, some things you can compromise, some things don't. Good. All right. Hi. Inaja, good. Nice of you to come by. Okay, if you just came in, thank you for being here. You can always watch the replay later. We have shared quite a fair bit of information. Yes, in our community, I see lots of questions. Recently, we just hit 40,000 Facebook like. Thank you, everyone. Okay, thank you, everyone, for your support. Okay, and without you, everyone in the community, we will not be able to hit this number. I'm grateful, okay, and I'm here to serve you all, okay, to hopefully by sharing some of the dental tips or information that I have here, I can have some value to you all right? So good. Thank you. Okay, question mark. All right. Okay, question mark. What does it mean? So it means lost your toothbrush. Let me see if they answer your question wrongly. Yeah. If I lost my toothbrush and unable to purchase it or bring it, so is there any way? Yeah, still the same thing. Or if you lost it, cannot get it, find a way to get it. Or if you need to borrow a toothbrush from someone else, of course, use your own toothbrush. But if you can't, the last thing you can do is borrow another person's toothbrush. But no, don't use another person's toothbrush. Find a new brush. Go and find a toothbrush. Just go and find it. Okay, I mean, there's certain things cannot compromise. Go and get a toothbrush. Don't use someone else's toothbrush. I correct myself. Don't do that. All right. I'll just try to figure out a question fast. So okay. All right. Good. All right. Good. So high fluoride concentration helps better tooth demineralization. Our Evan has this good question. So the high fluoride concentration helps to demineralize our teeth, to re-mineralize our teeth. First of all, how to prevent demineralization. Demineralization means losing mineral from a teeth. If you can decrease demineralization of teeth, then there's no need to remineralize. Remineralize means the tooth absorb mineral into the tooth. So first of all, how to avoid demineralize? Demineralize means the tooth losing mineral. So to do that, okay, same thing. Brushing well, flossing well. When mineral are lost, usually due to we need a few things to happen together. We need a tooth, okay, we need bacteria, all right, we need a tooth, we need bacteria, we need sugar, all right. These three things come together and with one more thing called time, okay. So I say again, we need sugar, all right, in food, we need sugar, we need the tooth itself, we need bacteria, and together with lasting time. So we have four things coming together, then we can have demineralization, eventually leading to tooth decay. So how can we avoid tooth decay? These four things, you limit one of them. All right. Either you can remove any food particles that's trapped in between the teeth. Removing any food trap, no bacteria. If you remove any food trap, no food, how can decay? If you remove bacteria by flossing and brushing well all around, of course, there's no issue. If there's no tooth, of course, there's no decay. That's obvious. Of course, time. If you clean twice a day, brush twice a day, floss every night, then there's no way bacteria can form or decay can form. So by doing that, then reduce the chance of demineralization. All right. Good. And reduce chance, then don't need to. Yes, high fluoride will do. In our local context, our water has enough fluoride, our toothpaste has enough fluoride. But in some cases, okay, dentists might still encourage you to use fluoride when we do see that you're very high risk. If you're very high risk at the tooth decay, fluoride treatment in the dental clinic is also pretty common. Okay, all right, good. Okay, this is the last question. I'm tired of brushing every day. What can I do? Okay, if you are tired of brushing, okay, every day, then do go and see your dentist every day. Just joking. All right. Sometimes I joke to my patients that, of course, if you find that the cleaning is tough, you can always get a professional help to clean. But there's also this much that you can go and visit your dentist. Usually we suggest 6 monthly. But if you want to, you can go 3 monthly or 3 monthly, 6 monthly to 1 yearly. There's no way that the dentist can actually clean your teeth every day. It's just not practical. It's too tired. Okay, find time. Okay, and find time or get into a habit of doing it together as a family. All right, do some family activity together. Make something, get something fun and out of it. Maybe make it a fun family activity for the family, and maybe that will stir more interest in brushing for yourself and for your family members. And well, maybe you can try that. Okay, you can start doing it tonight. All right. Good. Okay. Wow, today we're 1 hour into our program. Yes. Okay. If you all like what you're seeing, give me some like, heart, share. All right. And thank you. Okay. Thank you very much. Thank you everyone for being here. Okay. Good. Let me see here now. What else I want to show you all? Okay. Good. Okay. Yes. Right, let me see. Oh, yes. Okay, good. Okay, so do like. Okay, like and share this video if you learned something useful today. All right. Of course, you can go to my Facebook page, click on following, and select see first so that you can see my any posts or videos that on Facebook. So if you are watching this on YouTube, Facebook, or Periscope, go to Facebook and follow me. Okay, and click see first. Or if you're watching this on YouTube, okay, subscribe to my channel. Okay, everyone should go and subscribe to my channel. All right, turn on notifications so that you can stay notified for future videos. And that's also motivate me to, when I see the numbers, it feels okay. Numbers is not the most important, but it's yes, you can subscribe to my channel. All right, now I have, I think, 900 plus, 930 plus, I think, subscriber. Thank you for subscribing to the channel. Okay, and of course, thank you everyone. Okay, for being here. All right, I sure hope, okay, you all have all gained something useful. Okay, and from this interaction here. Okay, so good night to everyone. All right, goodbye.